Welcome, everyone. This is a unique opportunity. We have two professors in two locations teaching two completely different courses, and we're going to be kind of co-lecturing a combined pre-recorded lecture that two completely different sets of students are going to be able to watch. And the goal of this is to look at the idea of when we look at an event. And we're going to specifically focus on public health related events. When we look at an event, journalism is often described as being the first draft of history. And so we're looking at what are some of those forces or elements that go into telling this draft of history with journalism. And on the other end of it is that there are economic and legal impacts and consequences of the various, whether it be corporate or consumer or just public in general, not only the audience of the publication, but it could be the consumer, if you will, of a product, of an industry, or people that are subject to laws and regulations. And so with us today is we have Dr. Harp, and will you kind of introduce yourself to my students who have no idea who you are?
Yes. So my name is Dr. Dustin Harp. I am an associate professor in the University of Texas at Arlington. I'm in the Department of Communication. I am also the director of the Women and Gender Studies program. My background, though, is as a journalist. And then after getting my PhD, I've been teaching journalism courses for a long time. I've taught a lot of different kinds, public affairs journalism, feature writing, opinion writing, uh, goodness, just general reporting at the intro level. So that's my background. Why don't you
Excellent.
introduce yourself, Dr. Detwiler?
Sure. Well, for the benefit of your students, I'm Dr. Darin Detwiler. I'm the Assistant Dean at Northeastern University's College of Professional Studies in Boston, Massachusetts. I'm also a professor. I occasionally still teach. I'm a professor of food policy, and I've got over 25 years of work with food safety, food policy. In that sense, I've actually worked for the USDA and been a consultant with the FDA. But I've been employed by a newspaper. I've been a editorial advisory board and a columnist for many, many years within the food industry, and I've written some books, and I write a lot of columns and do a lot of media work. And so, on my end, I can't overlook the role of media and journalism in the work that I do here. Very much like how on your end, you can't overlook uh, law, economics, public health, ethics, so many issues, not
Right.
only that journalists cover, but are impacted by.
Right, definitely.
What I want to do really quick is we're not going to go into these articles too deep. We're going to make sure they're provided to the students before you watch this. But I'm just pointing out that some of my research that I have found, specifically looking at the difference between national coverage of an issue and local coverage of an issue. I did a case study of an E. coli outbreak in 1993 with fast food hamburgers, and I found that if you just look at the keywords of national newspaper headlines, it focused on the company and how the company was losing money and how the company was going to do this, and it named the companies involved. Didn't talk so much about victims, right? And then when you look at the state and local papers covering the same exact event during the same exact period, yeah, a couple times the headline keywords did mention those, but more often they would focus on the community, they would focus on the family, they would focus on the victims, and that was the angle they were taking. So if you were looking at national versus local papers, my finding is that you'd probably get a different story. I also looked at a more recent event, the romaine lettuce outbreak, and how the Boston Globe had an article that really focused on the victim, and that was the predominant focus of the story, though it did talk about the events. Whereas there was an opinion piece in the Wall Street Journal. If you had read that alone, you would assume there were no victims. No one ever got sick. No one ever went to the hospital, and this was all just an economic burden on the industry. So let's talk about that. Why are there different approaches or different takes on how a story should be covered?
Yeah, that's a really good question, and it's super complex to answer. So I want to start out by saying that there are a lot of influences on any story, right? And how it gets told. Um, and in the field of journalism and communication research, there's lots of different ways people talk about those influences. But one way they talk about it is the levels of influence. So if you just think right now, you have a journalist, right? So you have that personal person that's going to have their own thoughts and ideas about the world. Then you have media routines, which we can talk about, which is what are the routines journalists go through. Then you have the organization level outside of that, which is what kind of newspaper is it? And for example, you're talking local versus national, but you're also talking Wall Street Journal, which is very much a business kind of economics outlet, right? So, and then you have what we call extra media forces. So those are things outside of media, which is can be citizens, government, policies, all kinds of things. And then at the outer, you have ideology, right?
Mm.
And so I will just say, as an example, looking at right now something like when we talk about Fox News versus CNN, and we can look almost daily and see the what you would say is the exact same story, but it's covered in a very different way to not seem like it's the same story. And that's where you're seeing a lot of ideology come in, right?
Mm.
Because we're talking about Republican, Democrat, liberal, conservative perspectives that are having an influence on the news. So we have all those different levels. Um, so that's one part. And then the other is news values, which are, if you pick up any journalism textbook, they're going to have, here are the journalism values. Here's when you know something's a story. And so you have things like impact, timeliness, proximity, prominence, conflict, human interest. So what I would say that, I mean, all of these different levels are going to have different kinds of impacts. But when you're talking a local newspaper, I would say that when you're talking proximity to the victims, that all of a sudden makes that story more of the centerpiece for
Mm.
that local newspaper. When we're talking about Wall Street Journal and New York Times and Washington Post and LA Times, those are large newspapers that are a little more distanced from the victims. So I would say that sometimes that's why you probably will see um, the bigger picture story that they're trying to tell that's an economics. But I wonder too, Darin, how much, part of journalism is we write a story one day and it's gone, and then we write another story and it's gone, right? Because journalists are writing a new story every day. And if you look at if you looked at the Wall Street Journal and how did you find other articles? Do you remember if there were other articles during that same time that talked about the lettuce, um, the
Not
romaine
in
lettuce
that
story?
not in that same issue, but there were
Mm,
other articles there. And I will point out that I recognize some newspapers or magazines, um, if they have an opinion piece, they'll have like an opposing view, right?
mm-hmm.
So literally like right side, left side of the page or whatever to make
Yeah,
sure that there is literally that fair and balanced
right.
type of
Well,
approach.
and I think that you hit on something, and it's what I was talking about. It's like we write a story today, and then tomorrow we write another story, and we write another story. And as a journalist, if you're covering something like the romaine lettuce outbreak, you may write 15 stories in 3 weeks or in a month. So what journalists do is they have to come up with new angles to talk about the story. So why it becomes a problem is often because people don't read every single day, every single story, so they only see one or two, right? And they don't get the full picture.
Sure.
Um, so some of that,
So can I can I
yeah.
can I build on that really quick? So
Hmm.
let's say 10 years from now, someone coming back and looking at the current coronavirus scenario, right?
Yeah. Yeah.
If if a student was looking at this and only looked at one article, that is one perspective at one point in time. That may be part of the bigger collection of work, but it's not the complete story. So you might want to look at, and I guess I'm asking this, would it
Yeah.
be a good idea for a student who's doing research on an event like this to say, I want to look at a local coverage that may be closer to the epicenter. I want to look at something that may look at the national or international response. I might want to
Yes.
look at something immediately, at the beginning and maybe something a little later to be able to observe those different dimensions of time and place when it comes to those perspectives in journalism.
Yeah, but I even think if we get down, like we said, to the individual journalist level, right? So we could pick out, let's see, March 1st, right? Because that was a few weeks ago, when this coronavirus was really starting to cause concern in the news. And I could still pick out probably from local newspapers, you know, randomly 50 articles from across the country on the same day, and they're all not going to have the same perspective, even.
Sure. Is it safe to
You
assume that there could be an article that talks about how this is impacting schools and another article by a medical journalist who is talking about safety precautions and looking out for our children and our elderly parents?
Absolutely. And another article that says, support your local business, go out to eat, right?
Right. That
There's the
conflicts with what the
ideological.
public health officials, yeah.
Right. Um, so, you know, I think that it's interesting because we've switched so quickly to talking about the coronavirus. But what I'll say is, you know, journalists are humans and they
Yeah.
are all different. We're not all the same. We're not all going to tell the same stories, and we're not all going to tell the same stories on the same day. But I think that when you look at a local newspaper, what you can hope for is in 2 weeks of coverage of that coronavirus, you're going to get the story about education. You're going to get the story about medical. You're going to get all these different. You're going to get the business perspective. You're going to get the victim perspective. You're going to get all these different perspectives. But what happens is it doesn't happen in one story,
Sure.
and so. Um, and you and I both know some of the stats of also about how many people actually read stories versus just read
Oh,
headlines,
just read the
right?
headlines. Yeah. I mean, you and I are of an age, I'm not going to tell our ages, but when we were younger, it was what appeared at the 11 o'clock news. There wasn't the internet,
No,
and so if you were lucky, you've got a minute or two of coverage of a major issue on whatever the 5 o'clock news and the 11 o'clock news,
yeah.
and then whatever's going to appear in the newspaper the next day. And today there's so many different sources, uh,
Hmm.
but
And
they're all still kind of fighting for that angle or that sound clip, that sound bite, that viral aspect of it as well.
yeah. Well, and this brings up something that I've been thinking a lot about, which is a little bit off topic, but not completely. Which people are really stressed out right now, and a lot of them are even blaming journalists and the media, which is a
Right.
pet peeve of mine to even use the word the media, because the media is a vast and varied conglomerate. So it's better to talk about journalists or social media and not just say the media. But you know, there was a time when, yes, we only got an update maybe in the morning with the paper, and then in the evening at 5 and 11, or 6 and
Yeah.
10, whatever. And so we got a few updates a day of what was going on. When cable news started, we started with a 24/7 news cycle. And so now with cable news and social media, there's always something new to report on, some news story. And as journalists, everyone in the newsroom had the same time deadline. All our
Hmm.
stories were due at the same time, and then not again for 24 hours. But now journalists, just as soon as they finish a story, it comes out. So there's just all this news and information, but also the pressure on journalists to come up with a new story idea, right?
Right.
So I remember sitting in news editorial board meetings in the morning. Okay, what do you got today? What are you going to write about today? And every single day you've got to come up with something to write about. So think about the romaine lettuce. So if you're the health beat, you're going to come up with something from that, right? If you're the business beat, which means the
Yeah.
beats are you're
The
going to come up with a
department.
business story. Or the
Yeah.
science, medical, you
Right.
know,
If you're a
the
sports
education.
writer, you're you're probably going to look at it from a different lens, a different perspective than the financial writer or the business writer
Yes,
or the uh,
yes,
the court
absolutely.
reporter, not the court, you know
And
what I
they're
mean, the
not
court.
all going to be on the same day,
Right.
you know.
Well, you know
So,
what too you brought up is the idea of with those, like, you got the update at the end of the day or the beginning of the day. There was some time, I would imagine, to kind of sit on an item for a little bit to see how it plays out. When I was younger, if there was on the television a "we interrupt this broadcast," you
yes.
paid attention. Now,
Hmm.
and that happens like every 10, 15 minutes, but it happened only maybe once in a week or two, kind of a
Oh,
scenario.
maybe a couple times a year, really, right?
Yeah, it depends on what age you were at the time, but it was rare. It was rare when you had a "we interrupt this news."
Yes,
Now you keep,
yes.
refresh, 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 refresh. Is it
Hmm.
changed yet? Is it changed yet?
Yeah,
Kind of a thing on your computer or on your phone,
right,
right? And
right,
so there
right.
is this, yeah, this urgency of get something quick, get it out there, and have a different perspective or a different angle.
And so it has, I mean, I don't think, and I think most journalists would say that the 24/7 news cycle has harmed journalism more than it's helped journalism, because of the kinds of pressure that journalists are under with that kind of, a flow of information and expectation. Getting back to thinking about national and local too, I just think that in that national and local newspapers do serve different um, communities, and different they have different expectations of them. And something like these big national newspapers, they are trying to cover it from a national perspective, a big wide lens, where when you do have the local, they can cover it more from the how it affects people, you know but I find it interesting. I mean, I'm teaching feature writing right now, and feature writing, we talk about, it doesn't have to be, a silly, fluffy story. It can be a serious story, like, um, I'm encouraging them all to write things about what's going on with the coronavirus right now. But and so the story that you shared with me about the romaine lettuce, and it was a very heart-wrenching story about a little boy whose life was forever altered, and his family's life. Um, And those are the kind of stories that we encourage in feature writing class because we're always asking students to put a face to the problem,
Mm-hmm.
so that it becomes a human issue and not an economic issue, a statistics issue. Because the story you shared with me about from the Wall Street Journal was so statistic heavy, right?
Right. Right.
Um, and we're seeing some of those stories with the coronavirus. Well, you know, don't worry because statistically this, that, and this is why you shouldn't worry. And it's easy not to worry until you're the one, right?
Right.
Um,
Exactly. I mean, everyone. Exactly that idea that sure, everyone sees statistics and they want to see themselves as the not affected. But if you are part of that affected, the other thing
right.
is that what's that? I think it was it Mark Twain who said something about the fact that statistics are the greatest tools of those trying to deceive their readers or their audience because they're
Ooh, I
so
don't know, but
easily
that's,
manipulated.
oh, absolutely. I mean, that's another, oh, data journalism is another course I've taught. And that's exactly what we talk about is data can be used in so, by both
Sure.
sides to create a story in opposition.
Yeah.
But
Well,
you talk, oh, go on.
I was going to say it's to say something like, and I'm making up a number, so don't quote me on the number, but to say that only 0.03% of the American population will be affected by something, it sounds so small. Okay,
Absolutely.
how many people, however, are 0.03%? If 0.03% equals the entire city of Arlington, Texas, then if you live in Arlington, Texas, zero point zero 0.03 does not sound so small anymore.
Right. And so can you imagine the Dallas Fort Worth area newspapers would be talking about it very differently than maybe the national and
Yeah,
someone in San Francisco writing about it, right? Because
sure.
the proximity, we don't have to worry about this kind of
Right,
thing.
right.
Um, you know, so
Another thing too that I want to bring up, and you and I actually had talked about this some months ago, is there's also this phenomena over the last few years. We don't have the same number of local papers. So many of them
oh yeah.
have been shut down or consolidated or shifted from print to online. This also has an impact in terms of some of those the ideology, the routines, the perspectives that you were talking about, I would imagine.
Absolutely. Yeah. So there's been a loss of local newspapers. But there's also been a cut. Even the papers that still exist today have much smaller staff. So one of the places well, there's a couple uh, places where it's been a big hit, and one of them is science journalism
Yeah,
and science and health, right?
yeah,
So you keep your general staff that can cover everything, and you get rid of your specialty journalists. Um, so, some of these stories too can be really complex and, about health and science or if you've been hired to write about health and science, you're going to be looking at the world that way and
right,
thinking about stories that way. But when you're a general, reporter, you might just be just the facts, who, what, when, where, why, how.
sure,
Okay, finish
sure.
that. What else do I have to do?
So, through the research for a book that I wrote, when I was looking at journalism, I interviewed some people who were nightly anchors, they're print and broadcast journalists who've been looking at some of these issues. And one of the things that I learned was that there are only about five recognized uh, trained, dedicated, this is all they do in terms of focusing on food and public health journalists in the United States, that it's radically decreased because of the newspapers closing, the consolidation, the downsizing, and the pressures on journalism at this time.
Yeah, yeah. And it's very unfortunate because, journalists are everyday people like you and I. We also are we have there's a lot of variety of journalists. We're not all the same. We don't all think the same. We don't all do things the same always. Um, but yet it's really unfortunate that there journalists have really gotten a bad rap lately, and
Yeah.
talked about as the enemy of the people, and and honestly, I mean, I've been a journalist, and I know lots of journalists, and I've been teaching journalism for 20 years, and it journalists care. They're trying to do a good job. They're trying to tell stories that matter.
And I think we got to look at that. I think kind of in closing, because I know that both of us have other things going on here with our classes and life. Um, um, just as much as one could say, um, the straightest distance between any 2 points is a straight line, or I'm sorry, the fastest distance between 2 points is a straight line. When it comes to doing the research, when it, as a student, or even in terms of if you were a journalist, um,
Hmm.
making sure that you're looking at multiple resources, looking at it from the local perspective, looking at it from the national, maybe also from the international perspective. Look at it in terms of, is this a reporter who is a specialist in public health or medical journalism? Is this a
Hmm.
specialist in economics? Recognize they're going to have different perspectives and add different elements to the story. But if we just stuck with
Yeah.
any one of those, we stuck with one paper or one writer, that's not going to give us the diversity and the total objective view of what's going on.
Right, right. I think that that's a really, really important point. That's, part of media literacy is really going, having a lot of breadth and depth in terms of what you're looking at and what you're reading. The other thing is just time. I mean, we talked about, how long an article is, and there's been research since the 1970s saying that people spend, like, on average, 5 seconds per story in a newspaper. And that's because some they would read the whole story, and others they would read
Right.
the headline, right? But people don't always read your whole story. And so journalists can't write, a 6 page, you know, article for you to read, that would maybe offer all those different perspectives. So that's why you get a chunk today, and you're going to get a chunk and tomorrow, and it's going to be, broken out into different parts of the story being told in different ways on different days, because, there's only so many words that you can turn in as a journalist, and that your editor's going to publish, and that people are going to read. One thing I do want to say, though, is what I have been seeing in my research, and I've been doing some research on maternal mortality issues, and that when you and some other, I've been looking at research on other health journalism issues. When you write a series, so that you can say, this is going to be a series that's going to come out every Sunday for a month, or this is going to be a series, and for the next 7 days, each day we're going to have an article about this. By doing it that way, by packaging it for the audience instead of just the random stories here and there, the audience becomes aware that it's a bigger story, and that they're going to tune in to
Mm,
the next parts. Or on the web, I mean, it makes it easy. They can read them all at once, almost like,
sure. Like binge watching.
like binge watching, right? um, but what those stories, I mean, there's been research that shows when you cover a story that way, it has more of an impact on the people and the policies, because it's all, I mean, the one thing journalists do well is they do research and they find different perspectives. So when you can package it as a series, and get all of that, and know that you're, if you read one day, that you're missing multiple parts, so that's something that works well, but it's expensive.
Yeah.
It's, it's, again, it's not happening much in newsrooms. Long term, like feature story writing, investigative reporting, those things take time, and they're not journalists aren't getting paid to do that much.
No. And of course, the newspaper's also looking for additional revenue streams through advertisements and those things as well. Just like
Subscriptions.
online, yeah, just like online, there's going to be ads with certain things, ads in our videos, ads with our stories. And,
Yeah.
I just, as you were saying that, I was thinking about how I remember when I don't remember who said it, but I remember it being said that the internet was going to be the death of newspapers. Well, clearly there are still newspapers in print and online.
Right.
The internet's not the death of the newspaper. It's just really kind of changed how we look at the news in terms
Mhm.
of the message that's being delivered, but also in terms of how people are receiving these messages. And it'll continue to be
Absolutely.
something that we have
Yeah.
to, whether we're an executive in a company, of like let's say a food company, um,
Yeah.
looking at looking at the romaine lettuce, looking at an outbreak tied to a Mexican restaurant or something like that. Um, I might work for a different company, but if I'm not paying attention to what's happening to other companies or in other places and not thinking about how that could impact me, then I'm kind of missing the boat in terms of being up to date and aware of the forces that are impacting me
Yes.
economically or legally.
Yes. Yes.
Well,
Yes. Let me just say one last thing about that, because
yes.
what's happened is, so you have, some really good news organizations, but you have to pay to subscribe online to get those good pieces of
Mm,
journalism. For example, the New York Times, which I think is a good source. So what happens though now is everybody wants their information for free because of the internet. And so if they have to pay for really solid, good journalism, they end up just finding blogs and, you know, less, objective pieces of information. And so, yeah, it's a very complex and
could one
problematic situation.
Could one extrapolate from that when it comes to public health reporting, that the largest percentage of people, perhaps, that are impacted by public health issues may be the very people who can't afford to have that subscription to be able to read the most accurate and detailed journalism accounts of the story?
Yeah. Absolutely. And you think about even prior to the internet, what you had was newspapers who were supported by advertising. So they were much more likely, and you know they want to write stories that attract the people that the advertisers want to attract. So yes, journalism has always neglected the poor at some level, or the marginalized, and those are the people that need it the most, the voiceless. So
Yeah,
yeah.
yeah. There are a lot of issues. We could literally have another conversation like this talking solely about marginalized audiences and ethics, but that's not what we're talking about today. Well,
No.
uh, Dr. Harp, thank you very much, and I hope that both your students and my students are able to gain from this conversation. I am not an expert in journalism, but I definitely think that if more people outside of journalism who are talking about whatever discipline they're teaching were to bring this kind of conversation about journalism and where their students get their information from, that perhaps
Yes,
we'd all benefit.
I think so. Yeah, thank you,
Great.
for inviting
Thank
me.
you very much.